Kyrgyzstan. Steppes, mountains, herds of cattle and only 5 million inhabitants. In spite of a wealth of natural and mineral resources, the citizens of the new state find themselves confronted with considerable problems. When we were part of the Soviet Union, the state took care of us. We received clothes and healthy food. As a shepherd in this kolkhoz, I had a regular income. But with the collapse of the Soviet Union, this kolkhoz was privatized and dismantled. From then on, things went from bad to worse. Chongdebe, a remote village in the north of Kyrgyzstan. At 2,000 meters above sea level, the inhabitants make a living from farming.
In the days of the Soviet Union, we had a bus here and it was cheap. Now we have to ask a neighbor to give us a lift. And he expects to be paid for it. But money is a big problem for us.
This former Soviet republic had been financed with payments from Moscow for the last 70 years. The Soviet healthcare system was free of charge for the local people, had well-trained specialists in each village and enormous hospitals in every district for such a small population. That was the glorious Soviet era. All at once, in 1991, there was no more money from Moscow. There was a plunge in doctors' salaries. The new state could no longer provide money for healthcare services and the necessary repairs to the crumbling hospitals. The infrastructure collapsed. Only cold water comes out of the taps here nowadays. But for some time now, we haven't had any water at all. This is an operating theater, and operating theaters should have tiles on the walls. We are obliged to clean our surgical instruments with water from this watering can. Look at that. The electricity supply is always failing. The surveys we've made indicate that over 50% of the patients operated on suffer from an infection contracted as a direct result of their operation. Even in the capital, Bishkek, it is 30%. That is a very high proportion from an international point of view. Since 2002, and at the request of the Swiss Confederation, the Swiss Red Cross has been assisting the Kyrgyz Republic with the reform of its healthcare system. 5 hospitals are undergoing complete renovation, and there is better training for hospital staff. What is more important is that health committees are being set up in the villages. The Swiss Red Cross has given government healthcare providers special training to equip them for their new function. The first village health committees were formed 5 months ago. In the last few weeks, the people involved in the project have visited 111 villages. Today, they have come here for an exchange of ideas based on their impressions.
All the people I asked were very content. I asked them if they felt that our project was relevant to them personally, and they all said it was. They said that they liked our warm-hearted approach and our direct and uncomplicated manner. They want me to visit them regularly and to work together with them.
If we behave differently towards each other, me with you and you with the staff of the health centers, then that will serve as an example. This approach starts with us and is central to our work here. The first step towards the formation of village health committees is taken when the local communities begin analyzing their health problems themselves.
To begin with, one of our village nurses was trained, and then she organized meetings with the members of neighboring households. Almost all families took part in such meetings. First, the people made a list of their most important health problems. Then they gave highest priority to repairing the public banyas.
This is often the first time that healthcare providers are not telling people what to do, but listening to them, to find out what the people think are their biggest health problems. The households elect their representatives for the village health committee. They are expected to plan and implement measures to combat the health problems they have identified. In the houses of Chongdebe, there is no running water to have a proper wash with, and the public banya, the traditional Russian sauna, has been out of order for years. It was clear to people that poor hygienic conditions are responsible for a large number of health problems. That is why the health committee had the old banya repaired first, using money from a special fund connected to the project, and the boilerman has been able to earn his living here too. The income from the banya is divided into 3 parts. 1/3 is spent on coal and electricity, 1/3 goes to the committee, and I get the rest for my work.
We hardly have anything to live on except bread and tea. We plant potatoes in the garden. We can't afford meat. My health is not so good. I get tired quickly. I have headaches, get dizzy spells, and often break out into a sweat.
These are the signs of anemia. Half of all women and children in Kyrgyzstan suffer from undernourishment and an inadequate diet.
I know how important vitamins are. That's why I grow fruit and vegetables in my garden and give them to my children and pass them on to friends and neighbors. The health committee has distributed seeds in the village and explained to the inhabitants how to grow vegetables and how to prepare them. There are all sorts of vegetables that can prevent anemia.
In mountain regions, there is a very low natural concentration of iodine in the normal diet.
A kilo of salt, please. And please test the salt for iodine.
Lack of iodine can lead to goiter or harm the brain. By iodizing salt, it is possible for the whole population to absorb enough iodine. The health committees have provided shopkeepers with a special solution for testing purposes. This enables them to test the salt for iodine already at the wholesalers.
It's iodized. I'll take it.
The salt campaign in Naryn province cost as little as $2,000, but its success has increased the self-confidence of the village health committees. It is in this way that modern health promotion does far more than just provide health education and distribute information. Ultimately, good health can only be promoted when the factors that bring about health or disease can be influenced by the people concerned.
Our first test showed that the salt in 82% of the households in Chongdebu is iodized. The second time it was 93%, and today it's 96%. We've done a good job. The local people trust us. They are convinced of our good intentions and give us their support.
A central aspect in our concept is the link we are developing between the work done by the local population and the village health committees on the one hand and the healthcare system on the other. Often the processes involving local people take place quite independently of the state system, and we aim to bring these two together so that when our project comes to an end, the structures in the villages, such as the village health committees, will continue to have the support of the government healthcare system. That is one point. And another point, at least as important, is that the government healthcare providers should maintain a close connection with the population as a whole, so as to be able to find out and understand what is important for these people and then take the necessary action. So far, within the healthcare system, there has been no perception at all of what people's real priorities are. Since we elected the health committee, the solidarity among those living in the village has increased. Our experience has been very positive. I can truly say that in our community, friendships have become much closer. We help one another, and now we are again working together in the fields. In Lama, one of the neighboring communities of Chongdebu, the village health committee has started on a project to improve the local infrastructure.
We used to drink water from this stream. It is dirty and makes you ill. That's why the health committee called a community meeting, and it was decided to provide the village with a new water supply. We received 80% of the cost of the materials from the Swiss Red Cross, and we collected 20% from local people. The work of laying the pipes was all done on a voluntary basis. Since the introduction of the health committees, a lot has changed in our village. Now we know that we have to take action ourselves if we want to solve our problems. Our success in building this water supply system was an encouraging experience. Now we have new objectives. We intend to build a community hall.
In the course of their work, health committee members learn how to cooperate with the representatives of other organizations and how to find new sources of income, as well as extending the scope of their activities. I've noticed that many women in Cheongdebu drink a lot. That can have serious consequences. We should do something about it. Even community leaders like to get drunk. They are the people who have an influence on village life. They should be setting a good example, though. The authorities must act and close some of the places selling alcohol. We must begin with ourselves. Alcoholism rapidly leads to poverty. Some people have sold all their possessions to get enough vodka. If we can't stop alcohol abuse, we'll never put an end to our poverty. Investigations made by the village health committees show that in each village, several $1,000s a year are spent on alcohol. That opens people's eyes. They want to get rid of old customs like bringing alcoholic drinks as presents when visiting. Before parliamentary elections, candidates make use of large quantities of vodka to help convince the voters to vote for them. The health committees do not want to accept this practice any longer. They fear for the success of their work on prevention. The Association of Village Health Committees therefore decides to demand in open letters to the candidates that no free alcohol should be distributed. For the first time, election campaigns are conducted without any alcohol being consumed. This trend is becoming apparent at other events too. So it is becoming clear that something else is happening which is quite outside the realm of healthcare. It is the strengthening and further development of a civil society and the awakening of the ability to create a democracy right from the grassroots. I think it is not by chance that in the meantime several health committee leaders have been elected mayor of their village. It is because they have been given the opportunity to develop their leadership skills, have become involved in local affairs, and have been able to demonstrate their general trustworthiness. Perhaps we'll see the emergence of a new group of leaders like this, with people getting to know the democratic process in a small way in the context of healthcare, thus being empowered to move on later to greater things. The Ministry of Health has recognized the usefulness of this approach to health promotion. It has been made an integral part of the new health reform policy and is binding for rural areas throughout the country.
Кимге арнасам, жүзү сүйкүм сулуган, ырым арнасам, жырмалышып кызыктар, ойнун сезишет.